Good evening, everybody, and welcome to the first episode of Perspectives with Dr. Sharath. I am Dr. Sharath Swami, a neuroanesthetist and an emergency medicine physician. And today we shall talk about how do you take a medical case. Now, a medical case is the first thing that a medical student comes across when he finishes their studies, and also happens during the course of their studies. So this class or this episode is intended not just for medical students, but also for patients, caregivers, relatives, attenders, or anybody who comes along with the patient to the hospital. To start off with, when a patient comes to you, it is important to know the patient's name, the age, and the patient's sex. The name is important because we begin to address the patient with the complete name, and that gives us a certain amount of confidence of the patient into the doctor. There are certain diseases that tend to affect the patient at a younger age group, some during middle age and some during older age, which is why it's important to note the age of the patient. And there are certain diseases that are seen in according to the sex of the patient. And the marital status will tell us to what extent the patient is psychologically comfortable telling you about their status and their sexual activity. The height and weight of the patient is important because it will tell us to what extent certain diseases affect the patient with respect to the weight of the patient, and certain patients who have a varying height during the course of their life, certain diseases tend to affect. The address of the patient is important because certain diseases are found in certain areas, and if a disease is found in one particular region of the world, it is known as an endemic. As we have all seen, the most recent disease that has traveled all over the world is the pandemic. And the history of recent travel is important because it can tell us from which area the disease hails from which areas the patient has passed through, and where the patient may have acquired the disease. A knowledge of the patient's pets is important because there are certain diseases or infections that are transmitted from pets to human, some through cats, through dogs, through monkeys, and maybe even reptiles. So that is why it's important to note the kind of pets the patient has and the amount of time they spend with them, and whether the pets have been vaccinated or not. Coming to the most important part about what the history is all about is known as the chief complaints of the patient. Now, this is the first set of symptoms that the patient tells you about what is bothering him or her. We generally move to a head to toe fashion, and inevitably we'll have to ask whether the respiratory system is involved. So when the patient has a cough, you have to ask them whether it is a dry or a wet cough. And if the patient has sputum associated with the cough, you have to see to what quantity the patient has, what is the color of it, and whether there is any variation during the day or the night. And since we are dealing with the questions of the lung, we'll have to find out if the patient has any breathlessness. Does it increase when the patient does any activity? And is there any variation during the day? Does it increase during the night? Does the patient become so breathless that they have to wake up from the bed at night and go to the window and try to take huge gusts of wind so that they can breathe properly? Does the patient also have any chest pain or abdominal pain or nausea or vomiting? And what are these pains associated with? Then to identify whether the patient has any fever, and if the fever is associated with chills, which means rhythmic contraction of the muscles of the body because of the feeling of being cold, and whether the fever increases during the day or the night, as well as the grade of the fever, whether it is of a high grade or whether it's a low grade. And moving further on to identify whether the patient has any symptoms related to the central nervous system. So you'll have to ask whether the patient has any headache, any dizziness, any weakness of the right side or the left side of the body, whether there's any blurring of vision or seizures or fainting episodes. So this gives you a broad understanding of which system of the body is affected when the patient comes to you, so that you can ask further questions based on that system. The history of the presenting illness is nothing but the story that the patient tells to you. So, depending on the kind of symptoms that the patient has told you, you will have to place it all in the form of a story. So, which symptom came first, and what happened when the symptoms appeared? Was there anything associated with the symptoms, and how long did the symptoms happen? And was there an increase in the symptoms? Was there a decrease in the kind of symptoms that the patient presented to you? And what did the patient do after getting those symptoms? So all of this will help you put the symptoms in the form of a story so that you can place in your mind as to which came first and how the diseases present to you based on the symptoms in the form of a history. Now, moving forward, if you have somebody who's middle-aged or even in their early 30s or their mid 40s, some of these conditions are seen to have happened more at a more younger age group as compared to how things were a few years ago. So you'll have to ask whether the patient has diabetes or whether they're taking medication for diabetes and hypertension or bronchial asthma, or if they haven't actually identified them having bronchial asthma, they could say that they have an allergy to dust and they have breathlessness while during the cold season, and they have a heaving sort of breathing. And something that is also associated with a chronic condition with respect to the lungs is the chronic obstructive pulmonary disease. So these patients are probably smokers who smoke a lot of cigarettes in a day, or they consume biofuel, which is, let's say, they work in a closed space with a lot of burnt fuel of carbon fumes in the air due to burning wood. This would can tend to get deposited in their lungs and cause them difficulty to breathe. Tuberculosis is inevitably a big burden, not just in India, but all over the world. And if a patient has had tuberculosis in the past, and if it was a pulmonary tuberculosis, which means a tuberculosis of the lungs, then the patient probably has either taken medication or not taken medication. And if they have taken medication, it would have been for a very long time, which could be anywhere between 4 months to 6 months to even a year. And you'll have to identify whether they have stopped the medication or they've resumed it, because this will have an effect on the course of the disease. Coronary artery disease, given that most people are diabetics and hypertensive, these inevitably lead to coronary artery disease if both are not controlled well enough. So, has the patient had any surgeries in the past? Is the patient taking any medication due to coronary artery disease? Or is there a stent in the heart? This is what we have to know. A cerebrovascular disease is nothing but a stroke. So, if a patient has had a stroke in the past, we'd have to know whether there is any weakness on the right side or the left side of the body, whether the patient can do certain things or not do certain things, and whether the patient is on blood thinners for the stroke that the patient has had in the past. Connective tissue disease, these are a group of disorders in which the patient might be on steroids for a certain amount of time. And this also has an effect on the various organ systems, such as the kidneys, the heart, the skin, the liver. So if the patient presents to you with certain symptoms or has had been diagnosed in the past, then this has to be documented as well. Seizures is something that requires lifelong medication and can also impair the lifestyle of the patient. So asking this will have an understanding of how the patient functions in the life, or whether the patient has been taking medications regularly or not. A thyroid status is important because it will tell us whether the patient has a hyperfunctioning thyroid or a hypofunctioning thyroid. So this will tell us whether the patient can assimilate the medications that you're giving them, whether they have a good appetite, whether their sleep is affected. Thyroid hormones have a multifaceted effect on various parts of the body. So this history is important so that we can assimilate it along with the rest of the case sheet. Now, not just what the patient has experienced in the past, it is also important to know the personal history of the patient. So has the patient been sleeping well? Has the sleep been disturbed? And is the patient going to the restroom well enough at regular times, or is it irregular, or does the patient suddenly feel that they're not in control of their sphincters and their bowel and bladder habits are irregular? All of this are important because it will identify whether the patient has a neurological issue or a more localized issue when it relates to the genitourinary system or the large intestine, on the whether the patient has any addictions such as smoking or alcohol or substance abuse. Like I said before, if a patient has chronic obstructive disease, one of the reasons might be smoking. And if the patient has a chronic liver disease, it could be due to the effect of alcohol. And substance abuse, depending on the substance, can affect different parts of the body. It could be the lungs, it could be the heart, it could be the kidneys, and it could even be, the psychological effect of the patient. Now, it's important to quantify all of the above because it could tell us to what extent the patient is affected due to all of this, and for how long the patient has been, presenting with these symptoms. And you will also have to ask about the patient's appetite. So, certain diseases present with decreased nutrition because of a loss of appetite, and certain psychological issues, psychiatric issues also present with loss of appetite and loss of weight. And the diet is also important because a certain amount of malabsorption happens if the gut is involved, and that can affect the nutrition of the patient, and it can also affect the various organ systems, which is why it's important to know the diet of the patient. So the patient might present to you with their file, which contains the medical and surgical history. And if they're not aware of the kind of medicines that they're taking, you will have to ask them about the types of medication taking, as well as the dosages of the medicine. This is important because the medication itself, the side effects of the medication can affect the general well-being of the patient, and not just the condition that the patient comes with. It's important to know what medication they're taking and how this can affect the various organ systems. Certain diseases may present as a complication of a previous surgery done in the past. So, if the patient has undergone a surgery, you will have to know the site of the surgery, when the surgery was done, whether there were any complications then. Because if there were complications then, and then the condition has worsened through time and then affected other organ systems. So, this is why you will have to know what surgery was done, what surgery the patient underwent. Now, this is important to review the medical file of the patient because in certain cases, when it's difficult to diagnose a patient and something goes wrong, the medical file will give you clues to narrow down the present diagnosis. So now that you have all of this information, depending on the number of books you read and the number of subjects you've understood, you'll have to come up to one particular diagnosis, because all of these information that you have taken from the patient will guide you to a few clues. And these clues are something you have to put together and come up with. And it's not absolutely comprehensive because this case history is only the history of the patient, which excludes the examination of the patient, which I shall explain in the next episode. So based on the clues that the patient has given you, you will have to try and figure out what are the other possible diagnoses the patient has. It could be 3, it could be 5, it could be 10, but it's important to keep them in mind because you will have an idea of which direction you can take your investigations into. And even after writing all of this history, you can always flip back and see what information you have, and whether you have forgotten to ask the patient something, or whether you want to clarify some part of the history, which is why it is important to have all of these documented in your file. And the importance of this case history taking is because it will help you identify the condition that the patient has. And in the new era, where in the form of quick diagnosis and quick treatment, we actually forget that we have to follow this process in order to lead ourselves to the diagnosis, because the diagnosis is the most important thing. At the times when the patient is being treated for something else, having skipping a few steps, and following this format and this procedure will help us better understand the condition that the patient has. So this is important because in the new age of telemedicine and AI, the personalized medicine is of vital importance because it helps to comprehensively look at the patient from a top to bottom perspective, as well as in a face-to-face manner, which cannot be completely replaced by doctors working at remote locations and not following the right ethics of medicine. So the next time you consider trying to take an online consultation, or trying to phone a friend and asking for them for a diagnosis or for a treatment plan, that will not substitute an actual face-to-face consultation with a doctor. So moving forward, the next video will be about how to examine the patient from top to bottom. Thank you.